First off, wanted to touch upon the Affordable Care Act, as it's been a continuous topic of conversation here in New Hampshire. On Wednesday, you wrote a letter to the Department of Health and Human Services and Secretary Kathleen Sebelius, laying out some of the problems that we've heard, obviously, from listeners and from small business owners and such across the state in regards to there only being one healthcare provider in the marketplace, and the fact that a good number, almost half the hospitals in the state, have been excluded from the providers network. In laying out the difficulties that have been here in New Hampshire, that have taken place here in New Hampshire, what do you hope to accomplish, and how do you hope that this situation will improve?
Well, one of the things that we've heard from people in New Hampshire, which I share, is concern about the limited network. Now, and like the governor, I expressed my concern about that to Anthem, and what I was told is that they were trying to keep rates down, and that was their reason for limiting the network. But unfortunately, the state insurance commissioner said that their limited network met the adequacy requirements for the state law. And so I think what I'm hoping to do as part of this letter and looking in legislation is to see if we can get a look through the Federal Department of Health and Human Services about the adequacy of the network that exists, so that at least for people who are willing to pay more, that they have that option of going to their doctor and hospital no matter what their insurer does. And I think this is one of the things that we're hoping we can get some attention to, because it's clearly still an issue. It's an issue for people whose hospitals in their communities have been excluded from the network, and I think we need to do whatever we can to try and fix that.
It gets back to the old being able to keep your doctor and your health care and the whole line. It's an unfortunate situation as this has taken place, and is there, in your mind, or would you have been more tepid with your support, or would you have supported the Affordable Care Act knowing how the rollout was going to go, or do you see the long-term benefits outweighing the difficulties early on? And you mentioned the marketplace. If there's not a marketplace, obviously the costs are going to rise. We've seen costs rise across the state with a number of individuals, whether it's in school districts, whether it's in private industry. Healthcare costs have gone up in terms of deductibles, in terms of copays, and all those things.
That's actually not totally accurate.
Well, the
fact is
they have gone
the
up.
costs have gone up for some people.
Right.
Costs have not gone up. In fact, they've gone down for other people. We've heard from a couple in Henniker whose premium had gone down $1,000 a month as the result of enrolling in the exchange. So I think we're hearing people on both sides, but the fact is, I believe everybody deserves quality, affordable health care. That's what I've worked for since I first got elected to the state Senate in New Hampshire, and that's what I'm going to continue to do. And I think we've got to look at what's working in the Affordable Care Act. I don't think anybody wants to go back to a system where if you had a disease, you were denied insurance coverage, where if you got a major illness, you were denied coverage after a certain amount of money had been spent, where you had limits on what the insurance company would cover, where young people couldn't get health insurance because they couldn't afford it. So I think there are important things about the Affordable Care Act that are working and working very well. I think we need to fix the things that are not working, and that's what I'm committed to.
So you like the law as a whole, but you see problems and you plan to address them, but you would still support it. You would still support it even if you knew then what you know now.
Well, I think as I said, what we would do in retrospect is I would have designed it differently if I had been designing it.
Gotcha.
Unfortunately, I wasn't the person who was writing the law. I think in hindsight is always 20/20. Right. You always know what you would have done better.
That is U.S. Senator Jeanne Shaheen joining us here on the